Like the mic there.
Okay.
All right. We're all set, Ronnie?
Yep.
All right. Terrific. All righty. Welcome to the weha.com weekly roundtable. I'm John Lyons, joined as always by the managing editor of weha.com, Ronnie Newton. We welcome our viewers locally on weha.com and statewide on Connecticut News Junkie. And we thank you for taking a part of your Thursday evening to spend with us. Tonight, we welcome the state of Connecticut's 89th governor, Ned Lamont, to our show. Ned, how are you?
John, how are you? Weha.
It's an honor to have you on, and we really are grateful for you to take a few minutes with us tonight. Thank you for coming on.
My pleasure. Hey, Roddy.
Hi, Governor. How are you? I feel like I've been interacting with you for the past several hours because I was on the press conference earlier tonight.
Wasn't that great? Did you hear Scott Gottlieb? He's very good. He's down at Westport, so big help for us.
I put him on our guest list. I want to get him on the show because he's terrific. But I'll lead right off, Governor, with COVID-19 and what Scott Gottlieb said. He led off today saying that we're at the 8th inning of this terrible plague, and I was very happy to hear that. But then when the onion got peeled back a little bit, he talked about how he thinks we're going to be at a 40% of the population will have had the virus by the time the vaccines are rolling out and that sort of thing. What can you expand on that? Did he expand on that? Tell me a little bit about that.
I was struck by 8th inning. We knew early on that the fall was going to be a second hit, just like the fall was a second hit back in 1918, by the way, when they had that bond parade in Philadelphia. It led to many more fatalities in the second wave than the first wave then. I hope we're much better prepared now than we were back in April, May. We've got the PPE. We've got, we're doing 200,000 tests a week. I mean, we're doing more testing than just about anybody. We can track and trace very carefully, but look, we're a small state surrounded by a lot of action. And let's face it, last time around when the pandemic hit us, it was more regional. Remember, it came up from the New York metropolitan area, hit southern Connecticut first, and we could mix and match our health facilities to maximize. This time it's across the country and across the state. So we've got to be prepared to fight on all fronts. But at least if it's 8th inning, we really think that we'll have the therapies and even the vaccine by January of next year and can start really chipping away at this.
So how well, because I know we got to a point pretty much where we are now in terms of hospitalizations back in the spring. How much better prepared are the hospitals to handle, and how much are you hearing from your experts? How much further is this going to go in terms of demand of resources?
If we can judge by Europe, if we can judge by the southern states and then the Midwestern states, they got hit hard. I mean, let's face it, South and North Dakota, they're about to overflow. That's like Italy back 8 months ago. In Connecticut, I think we're much better prepared. One of the good things, John, is that last time we were sending a lot of older people to the ICU. This time there are a lot of people going to the hospitals, but they don't necessarily have to go to the ICU. And they're spending half as much time in the hospital. We can create field hospitals to expand capacity. I think right now our limiting factor will probably be nurses and docs just being exhausted as we prepare for what's going on. But we've got the masks, we got the gowns, we got the testing, we've got all that well prepared. And we're looking for a few great folks with some medical expertise to help back up our frontline workers.
So do you think that even though we'll be maybe seeing hospitalizations ramp up quickly to hopefully not quite the levels that we saw in April, but that hopefully our deaths will not follow suit to be as high a rate as we saw back in the spring?
I think so. But making predictions with this damn virus is kind of complicated. And I got to say, there's no playbook for this, and we're learning along the way. Thank goodness we've got the best and the brightest right here in Connecticut to lean on. Folks like Gottlieb, the chairman of Joe Biden's COVID task force team, is a professor from Yale who was on our reopen committee. That said, I think our hospitals are as prepared as they can be. And the really good news is they didn't have a great relationship with the state a year ago, and they were sort of competitive with each other. And they're really working together as one, which is going to be an enormous help as we maximize people and maximize beds over the next 3 months.
So, Governor Lamont, talk with that in the theme of harmony and how everyone's working together. Talk about, obviously, there was big news earlier this week when Pfizer announced that the vaccine greater than 90% efficacy. Talk to us a little bit about, have you heard anything? Are you getting any guidance from federal government at this point on anything relating to COVID? That's part one, I guess, of the question.
Well, the good news is they're providing the Binax test to us at no cost. There's a little bit of a credibility problem down there, so not everybody believes necessarily the FDA and others when they say, go for Operation Warp Speed, this vaccine's ready to go. That said, look, the FDA is a pretty independent organization. You've heard Scott and others are going to opine on this. We put in place our own vaccine advisory board. It's made up of the best scientists we can. I'm doing that for two reasons. A, to give me assurance that when this vaccine is released, it is safe and effective. And the other thing I got to do, John, is at that point, convince others that it's safe and effective. So we've got ministers, we got labor leaders, we got legislators, folks who can go into the community, because the vaccine doesn't do us any good if people refuse to take it.
Yeah.
And right now there's a lot of vaccine skepticism. Believe it or not, right before COVID hit, I had 1,000 demonstrators outside the governor's office here saying you can't make me vaccinate my kid. And that was just for the flu vaccine. So we got a little bit of work to do.
I don't want to opine on political issues. That's not my role here, but I agree with you. And I'm glad you hit on that, because it was on my list of questions. I think it's a shame that it's turned into a political issue when I feel it did not have to be one. So I'm with you on that. So the second part of that question is, what is the latest you're hearing on vaccine distribution? Who would get the first wave of available doses? Who would get the second wave? That sort of thing.
Are you going to take it yourself too?
Yes. Older people, vulnerable population will be a target market. That's me. But seriously, we've got our team. It includes Reggie Eady from Trinity, right down the street from you. It includes Deirdre Gifford, our head of public health, and really some wonderful folks. We are going to work with the CDC, but look, it's no great secret that we're going to prioritize frontline workers, nurses and docs, those that we make sure they keep safe. We're going to prioritize those who are the most vulnerable, older, pre-existing conditions. We're working with CMS to get a list of, is it from Medicare? So we get a running head start in terms of who some of those people might be, so we can prioritize them. And we ought to have, a few 100,000 vaccines by very early next year. And then they do have, the feds have commissioned to buy 100 million doses. So that would be, we usually get about 1% of everything. So we get about 1 million doses, which I think we can count on, next year. And by the way, remember, Pfizer's not the only show in town. There will be 3 or 4 other vaccines, which maybe have different effects on different populations. So they'll mix and match to make sure you can maximize the benefit.
On a personal note, back to the vaccine conversation, I agree with you. And I keep going back to what Kamala Harris said in the debate when she was asked, would she take a vaccine? And yes, if the scientists approve it. My daughter caught COVID last week. I'm actually dealing with COVID right now. And I put my hand up. I will be the first in line to get a vaccine, because let me tell you, and I speak from experience, you do not want to catch this disease. It is awful. It has been a horrible week. And I think I had what the CDC would call mild symptoms, and it's awful. So, Ronnie, anything more on COVID? Because we've got other topics to cover, and we got 20 minutes left here.
Well, I guess the one question I was going to ask about the vaccine, and I'm still trying to think about that eighth inning and be optimistic about that. And I'm a baseball fan too, and I kind of feel like that's a glass half full or a glass 8/9 full. If the vaccine really does become available and if people start getting vaccinated, do you think, or does Dr. Gottlieb think that maybe that peak could be sooner and maybe we won't have to wait until January to really start seeing this actively turned around?
I don't think so, Ronnie. I think that the vaccine is going to take a while, A, to produce, B, to distribute, C, to convince people to take it. So I don't think it will accelerate the time we're on the backside of this. What I think it does do, which I tried to emphasize, is, all right, we're getting closer to the end. So I know this is a time when you're, oh my God, 6 people at Thanksgiving, I can't take another minute of this. God, I'm so angry at this, but we're getting close. And if I can keep people focused right now, you really can bend the curve, keep our schools open safely as long as we can. And that'll put us in a much better position when the vaccine is really effective this spring.
Let's not that there's anything good from COVID, but Connecticut has benefited in a way from COVID in that scores of people are moving to the state. They view it as a safe haven from the congestion of a big city, and we've seen tens of thousands, if not more, people move and purchase homes here in the state since about last April 15th. Have you any data on that? And how do you feel that could impact revenues, the budget, the grand list, that sort of thing?
You're absolutely right. I think people are rediscovering Connecticut and what makes this place special, John. And let's face it, we were a little out of favor for the last generation. The kids wanted to be the big metropolitan centers. What could be more sleepy than West Hartford on a Thursday night or whatever it might be?
Oh, no. West Hartford on a Thursday night's great.
It's really happening, actually. And that has changed. I mean, we've probably had 30,000 families change their address. And it's not just, West Hartford or Lower Fairfield County. It's all over the state. And I think it's the Connecticut lifestyle, the ability to be outside, the realizing that you can telecommute and you don't have to be in New York City 5 days a week, 1 day a week maybe does it. The fact that we kept our schools, more open than other places. We stood up for the values represented by the protesters and George Floyd, but we did it in a peaceful way. I think there are a variety of reasons that people are taking a second look at Connecticut. And you said, well, how does it impact us? You saw that our deficit numbers have gone down, each cycle. And there are a variety of reasons for that. One, Melissa McCall, who runs our budget, is a very conservative budgeter, for which I'm thankful. But just as importantly, we've got tens of thousands of folks who come to the state and are now paying taxes in the state. And I think that's making a difference as well. And it helps our fiscal situation. I mean, let's face it, it's a mess out there for 50 states. But thankfully, our deficit is less. Our GDP, our economy is more open. And we do have a $3 billion rainy day fund. So even if it takes Washington, D.C. months to figure out what the heck they're doing, it's taken them months to get nothing done for the last 3 months. I think we're in a pretty good position to weather the storm.
Have you heard anything from Washington with respect to aid packages?
No, I got to say I haven't. I mean, obviously, when the Senate stayed in Republican hands, that's going to change the dynamic. And there's still a dispute, about the incoming president. So I think they're going to be locked for a while, and the states are going to have to manage on their own. We managed on our own almost from the beginning. I mean, there was no stockpile down there. When you needed to get masks, we had to go to China to get them ourselves. And I'm very thankful for the CARES Act money that we got 6 months ago. And we're going to manage through until the new administration comes in.
Are you optimistic that even with with Republican control likely in the Senate that, President-elect Biden or future President Biden will be able to do some more compromising? That's really what he's known for, being able to step across the aisle.
I hope so. He's worked with Mitch McConnell for 30 years. So if he can't get the Senate Republicans to find some sort of agreement, I don't think anybody can. But, it's pretty easy to say no. I found that in this building, and I think they're finding that in Washington, D.C. And it's tough when you got to come up with solutions. It's easy to come up with an issue you can fight over. But I think you got a new administration. We have a pandemic. There's a crisis. I think people are going to step up and do the right thing.
Governor, I've got some legislative questions for you, and if it's all right, I'd like to bring your favorite mayor onto the stream here, Mayor Sherry Cantor, the mayor of West Hartford, because I know she has a lot of thoughts in terms of legislative action. I know you two work very closely.
How are you?
I'm good, Governor. How are you?
Let's go to the Della Bar. Can we still eat outside? I don't know.
We're fighting. We'll see. We can still eat outside. A little wet tonight. Michael actually went to our Gasher Park to get lobster rolls.
Oh, I'm going there as soon as we're done. That's on my plan.
Yeah.
I can't go anywhere for 14 days, but I got my ankle bracelet on. They wouldn't let me out of the house. So anyway, so Governor, I want to talk to you a little bit about legislative issues. Number one, it's looking like, if I'm not mistaken, you got a larger majority in the legislature, Democratic majority. Let's just talk generally. What does this do for your agenda and some of your policy goals?
I think that, look, Republicans outside of the presidency did okay around the rest of the country. We noticed that. Democrats did pretty well in Connecticut. I think one reason we did well is we've managed the state relatively well for the last year and a half. And we did what we managed from the center, and we were able to take care of folks in need. We were able to keep our schools open. We were able to do it without raising taxes. And I think that will be part of the message as we try and work with our Democratic friends and Republican friends. Look, I tell the Republicans as well, you got a place at the table. Come on in. I need the best ideas I can. But as I said before, give me a solution. Just don't criticize from the sidelines. We got good leadership in the legislature as well. Marty Luty's been there for quite a while. Matt Ritter has genetically been there for a long time.
What are some of your legislative goals over the next, let's say we get through COVID come March, April, hopefully we're on the mend from that and things return to some level of normalcy and that we have a legislative session, a normal one. What are some of your goals for the next session?
Yeah, John, I think I think we have a little bit of wind to our back, given what's happened in the last 6 months, 8 months in this state, and I want to take the best of what we learned and leverage that. Let's say we got to keep our fiscal house in order. That's not a majestic goal. Do everything we can in terms of workforce. If you want to know a priority for me. Back before COVID, we had tens of thousands of jobs we couldn't fill. And remember, we hadn't added a net new job in the state in 30 years. And that's going to change. I just figure this is an extraordinary time for those kids who have been left behind to make sure that they get lifted up. We get them a job training and skills training they need. I don't want to hear any more employers say, I'm leaving Connecticut because I can't find the right type of talent. We're going to make sure you have that talent. I come out of the telecom world. One of the things we learn is, when it comes to telecommuting and telehealth and what a difference that has made. So we're going to work hard in terms of IT and 5G and getting that expanded around the state so people can be able to live and work in Connecticut, not necessarily have to go to a big city for that amazing job. And I also think that we learned a lot during the protests, and I don't want that to be forgotten when it comes to social justice and people who have been left behind, and working with our disadvantaged communities to give them a shot in the arm and a leg up.
And Ronnie just reminded me Ronnie, do you want to handle the questions? We've got a lot of questions from viewers. Ronnie, you want to handle it? Or?
Yeah, so since this is a roundtable, we do have, and we were on Facebook Live, we've got a couple of questions coming in from viewers. And one is whether or not we have a travel ban coming into Connecticut. And I think maybe it's somebody who's looking to come visit for a while. And I don't know if you want to respond to that. I could give the answer, but I think it's better coming from you.
Look, if you're coming from South Dakota, please stay home. Sorry, I don't want to be mean, but look, more specifically, there is a quarantine. Here, I'll tell you, Ronnie, what I'm really worried about is college kids. All of our college kids were leaving Connecticut. We're asking the universities to test them for a few days before they get on that plane. They quarantine, and hopefully they get tested when they get home. And I want the same thing for people coming into the state of Connecticut. So we have thousands of kids coming in from around the country, coming home for Thanksgiving. They'll be staying here. You're right. You ought to test before you get on that plane and test when you get here as well. We did that when our universities opened up in September, and that made a world of difference. Broadly speaking, is there a quarantine? No. If you're an essential worker, you've got to come to Connecticut. Come to Connecticut, get tested so you can do it safely. If you can stay at home, probably a good thing to do if it's discretionary for now.
And if you're coming from New Jersey, like this person is, you're okay?
We have a.
You can come here.
We have a pact with New Jersey and Rhode Island and New York where you can travel back and forth.
Somebody's asking about if you foresee, they're using the term lockdown, but let me alter the question a little bit, Governor. Do you see us maybe having to step back even a little bit further on the phased reopenings?
Probably, John. I mean, I'm just looking at trend lines, so I don't want to make it up and say happy days are here again. But look, this is America. I mean, I told restaurants, please stop serving at 9:30, and I had hundreds of cars driving around the circle saying King Ned is taking away my freedom. So I kind of know the limits of my authority, but what I've tried to do is explain, like I did this afternoon, what we're doing, why we're doing, so people voluntarily, wear the mask. I can tell you there's a $100 fine if you don't wear the mask, we're to come at you. But for the other 99.99% of people, we've got to be convinced that we're doing this together for the right reason.
I'm chuckling, King Ned, because these are the people who 3 weeks ago were medical experts on Facebook, but I've got good news for you now. They're now electoral college and ballot counting experts. So they're no longer paying attention to COVID, I think. But anyway, we have another question. Cannabis 2021 was the question. Where do we stand with cannabis legislation?
What do you think, Mayor Cantor?
I think that all the states around us are legalizing marijuana, and I think we better figure out how to do it safely. So
I think Sherry's absolutely right. John, we learned during COVID, if, I close down my bars and Cuomo opens them up, everybody's driving back and forth. That's not a good thing. New Jersey just overwhelmingly supported legalization. Massachusetts already got it, Maine, Vermont. And we can do it safely. We can do it a lot safer than having that suburban kid go by from some, pusher down the street. And I think we can make sure that we regulate it in a way that gives people some confidence we're doing it right. So I do think now's the time.
One of the people here in town who actually ran for an office, he ran for state legislature 18th district, is asking a question. Rick Bush, any movement on opening the courts for evictions for very delinquent tenants? I know that's probably a really touchy question.
Well, for very delinquent, if they were delinquent before COVID, they're subject to eviction. But if these are somebody, frontline worker, lost their job in COVID, right now they're protected until December 31st. And my instinct is, John, that's going to get extended, to February, which is when my executive powers end. We put in place $40 million. And, most guys that just give you the money and say, please pay the landlord. We're not doing that. We give them $40 million So landlords as well as tenants can come. We try and negotiate a partnership that allows people to stay in their homes, stay in their apartments, and yet have put in place a plan so the landlord does get paid.
Ronnie, we still have questions coming in. You want to handle the next one?
So here's a question. Do you anticipate a COVID vaccine will be required for children to go to school?
That's a really good question. Hopefully not. I mean, hopefully people are going to do the right thing. We have the highest. I mean, I was already telling you about the anti-vax team that was around, but we had over 75% of our people get a flu vaccine, probably the highest in the country. So Ronnie, my hope is that we don't need a mandate for this, but look, if we want to keep our schools open and a lot of kids aren't getting the vaccine, maybe we'll have to look at that.
I guess it's probably too early to really even know at this point.
Much too early, yeah.
So we have a question, well, not really a question, a statement. Let's legalize sports betting. Do you think that's something that's possible for the next legislative session?
I think so. Again, I'm not a big sports betting guy myself, but it's out there. It's the other guys are doing it. It's a small revenue source, and so we're gonna work to get that done in this session. You know, a little bit of a dispute about who gets to do it. Do the tribes have an exclusive right to do it? Can others participate? So we're trying to negotiate that labyrinth right now.
It's a sticky wicket, especially with those with the two casinos. I know it's a very, very difficult issue. While we're on the subject of gambling, I know there's been talk of trying to develop the Bridgeport coastline, both for the purpose of a casino and for business, industry, and residential. Where do we stand on that issue?
I don't think it's going to be a casino down there. They're not building any more casinos. But I do think, look, when it comes to Bridgeport, they've made a big commitment to wind power, which is extraordinary. University of Bridgeport's about to be taken over by Goodwin College. I think you're going to see that expand in a significant way. And I think the wind should be the back of Bridgeport. I mean, it's easy access to New York City. Get that rail station upgraded. Housing at 1/5 the price of what your kid is paying in, you know, downtown New York or something. There's some real great pluses to a beautiful city like Bridgeport.
It is. I have a big client. I'm in Bridgeport a lot, and it's a wonderful city, and it's a shame how it's been ignored by a lot of previous administrations. And I think there's nothing but opportunity in that city. Just on a personal note, Sherry, let's talk you guys. Let's talk to both of you guys. This question for both of you. Talk about how you two work together and how you work with the other mayors to try to lobby the governor for various state initiatives, that sort of thing. Talk about your relationship. Talk about how you do that.
I'll say from my perspective, and I obviously the governor should say it for his, but he is completely accessible. We text, we call, we talk, we have gone out. I've been to his place, he's been to mine, to ours, my husband and mine. So it's a great relationship. We are neighbors, and it's invaluable to have somebody that is so willing to be open and listen. At times, we reached out to say we were having some problems with mask wearing in West Hartford Center, and the governor felt very strongly that there should be a unified, and we asked for some more teeth to the, with getting people to wear their face coverings. And again, his staff was incredibly receptive. They pulled together a town-wide meeting. There were other municipalities that felt the same way that we did, and they made a change statewide, which was really helpful. Again, messaging. But I am on the phone with mayors from around the country. I'm on a Bloomberg call every Thursday. And there are so many mayors that are so frustrated because their governors are handling things in a very different way. And Republican and Democratic mayors want to keep their people safe. And the governors don't necessarily have the same things in mind, and North Dakota was one of those governors. So also there was a mayor on in Florida today that was talking about how difficult it's been. So again, I'm so grateful to have that relationship where I have a governor who's a partner, listens, and responds, and gets answers. So appreciate it. So
Hey, thanks, Sherry, and right back at you. First of all, the governor's residence cannot be any closer to West Hartford without being in West Hartford. I don't know how that's put together, but
everybody parks in West Hartford.
But seriously, I mean, I come out of the business world, and I really feel at one with the mayors. They're executives, and they have to get stuff done. So there are folks that I reach out to across the aisle at every opportunity I can, A, to get best ideas, and B, as we work through this COVID thing, I can't impose. I mean, I've got to work. We've allowed West Hartford and all our places to figure out what they want to do in terms of schools, what they want to do in terms of sports. It's not something that you can just impose as a one-size-fits-all. And yet, Sherry, we've also tried to provide really clear guidance. So you know exactly where we stand on masks, where we stand on restaurants, so we get that balance right. So I think so far we're doing pretty well because we got great mayors like you.
Thank you. But we all know, again, we're building the plane as we fly it, right? And we're not going to be perfect. We're all going to make mistakes, and we have to forgive each other because it's really important to just do the best job we can do. And somebody said on a call that I was on very early in the pandemic, they said, if you're making a decision and it's easy, it's too late. So the decisions that you make are often hard decisions that people might not have the information or foresee where we're headed. And so, I think the governor is relying on science and talking to really, really reliable experts that have been partners again on his, and advisors to him. And so to you, Governor, so it's really, this is, I think Connecticut has been in a good place, and we need to keep it that way. So let's hope that everybody is listening and takes this seriously.
Governor,
say one other thing about West
Yes,
Hartford. I love West Hartford. Sherry, Jonathan Harris works on our team. I came from another suburb, down in Greenwich, and I tell everybody, the average age of West Hartford is 10 years younger than Greenwich. It's so much more fun. I mean, the Blueback and the outdoor dining. We were talking about Delamar. I love the vibe and the feel of West Hartford, and a lot of our other towns. I'm a little reluctant. I don't want to do anything downtown, and it sucks a lot of the life and oxygen out of it. My kids want to be in a place like West Hartford, and I want to stay where my kids want to be.
Thank you. And we've worked hard at that, and it has worked great. And when I'm at UConn a lot, those graduates, they want to come and live in West Hartford. So
hey, I've got 2 of them right here.
I've got one.
It's working.
A great school system, a very engaged community, a diverse, vibrant community, accepting, welcoming. It's all good.
Governor, we promised your people only 30 minutes. We're over time with you right now, and please don't think I didn't notice. We are respectful of your time. I do have 2 questions for you, but I want to ask 2 last quick questions for you. But Ronnie and Sherry, do you have any more questions for the governor?
No, just
I don't personally, but there is one actually kind of big question, and I know this was discussed a lot on the call today. So if you have time to respond, some concern about why schools are not all doing the same thing. You've got teachers living in one town, teaching in another district. Different districts doing different things in terms of being full in person or hybrid or all remote. Can you just talk a little bit about why the schools are not all having the same role?
Uniquely local. New Haven had one of the lowest infection rates in the country, not to mention Connecticut. But there were some folks there who were particularly hit by COVID and just said, I do not want to open my school at all. I thought it was a mistake. I thought it was a unique opportunity to have your kids in the classroom for 2 or 3 months, because who knows what December is going to be. By the same token, we had a lot of other communities that said, I'm going to fight to keep my classes open as long as I possibly can. And I appreciate that, teachers are sort of, right in the middle of that. But I think it's uniquely local how the schools are going. I'm really proud that Connecticut had, a majority of our kids had an opportunity to go to K through 8, full time, up until very recently, where you may see some pulling back. Hartford just had to go to hybrid in the last week or so.
Governor, thank you so much for coming on. I mean, we've never had this type of community engagement, and we've done a lot of shows and we've had a lot of viewers. So we are really grateful for having you on. You are now 2 years goes by quickly. You're 2 years into what has become a very unusual term. And I think most objective voters would say you've had a very good first term so far with your handling of COVID and other issues. Number one, are you enjoying the job? And number two, are you thinking about running for a second term?
I love the job. All anybody does in this building is run for office. I think time to spend some time governing. We got a few things on our plate, and that's what I'm focused on. But I'll tell you, this last year has been really meaningful for me. Democracy is really messy, and everybody's stepping all over each other and getting angry. But when there's a crisis, nothing's better than people standing up, and the people of Connecticut really stood up in a very, very powerful way. I got to give, I mentioned the hospitals working together. The ministers came forward in a way that I really needed them. Republicans gave me a little bit of latitude to work with executive orders. So at a time when you needed Connecticut to come together, Connecticut came together. And I think we've made a good difference on behalf of folks here, and that's why I love the job, because if you can make a difference, you keep going. Thanks, everybody. It's really
Governor
nice.
Ned Lamont, thank you so much. Sherry, hang on. We're going to pick your brain a little bit here. Governor, thank you so much.
Ask
Thank
her
you so
really
much.
hard questions. She loves hard questions.
I do.
We're
Thank
going
you,
after.
Be well.
Take care. Thank you.
Thank you.
All right, he's clear. That was wonderful. That was really nice to have him on, and he gave us 10 extra minutes too, which I think is a lot of time in the schedule of a governor. Sherry, what'd you think?
I thought it was great. It was great. I will say I had a little crisis here. My husband, I think, must have left the door open. There was a bird in my house. So
Oh my gosh.
I'm trying to listen. I'm like, oh my God, I gotta get my husband in nostrils. It was weird. Anyway, but it wasn't a bat, which was good.
Yeah, the bats
Oh,
are the ones that get a little scary.
Yeah.
So.
If it was a bat, I'd have to move.
But I did good. I turned all the lights off. I turned the outside light on. I left the door open, and it flew out.
So Sherry, we got you here. What's going on in town? Any news? What's the latest for the restaurants? Anything to tell us?
No, so things are good. We actually had a report. I don't know if Ronnie's going to be writing about that. Well, Business Buzz tells so much. But Kristen gave a big report last night on economic development, Kristen Gorski in town. There's a lot going on. I mean, there's our vacancy at the center is so low. We have one vacancy. So remarkable in these times. There are some, we still have Stop and Shop that will, ShopRite, sorry. Yeah.
Right. Yeah, you're right.
The former ShopRite, yeah.
over across from McDonald's.
Right behind One Park. So, that's been vacant for a little while. There's something at Seritage that's also been vacant, and those are big spaces, so that sort of drives some numbers that are a little higher for us. But we're worried about the winter months. And
As expected.
Yeah.
Dog. My dog has to visit.
Ronnie, I thought you were chuckling for the reason I was, because
I'm sorry. I'm chuckling because
the
dog was
Jerry,
going to come in.
thanks to you, the hashtag Birdgate is now trending. So somebody put that in the chat. So I got to give them.
I can't wait for that to open.
On a more serious note, we're going to make it through to Christmas and the Christmas break. Schools as they are. Do you see a change in scheduling? What do you think is going to happen?
Well, I spoke with the superintendent this afternoon, and they're really committed to to keeping kids in school if they can. I mean, obviously, if the state does something,
right.
we're and the numbers they're different when you're put in a red category, right? For community spread.
We're just barely red. What are we? 15.8. So
right,
0.8 into red as of today.
Right, and the schools are 25, so there is some room there. But if the schools go up, and the spread really happens, and it's interesting. I was talking to somebody from Orange today. We were talking about why obviously there is national spread and people are traveling a little bit and they're loosening up a little bit, whether it's a work situation and you didn't, keep your distance, and you both didn't have your masks on inside, that can make you, that community spread kind of a thing. But also, you know what, I don't think election did that, but Halloween, we're about 2 weeks out from Halloween. Were there some things that happened at Halloween that are creating the spread too? So, we don't know, but I think right now, I mean, at least I do think elementary schools will stay. I'm hopeful.
I feel like one of the challenges with this incredible spike, which I know everybody forecasted since the moment this thing started last March, everybody said the fall is going to be brutal. But I think one of the things that's surprising to me is in the spring, it was really, it was very clearly defined areas that were getting impacted: old age homes, retirement communities, things like that. This time it doesn't seem to be that way. It seems to be a little bit of everything, which really makes it complicated and really hard.
That's exactly what's happening. And that is what every scientist and Dr. Fauci predicted, that it would start. And there are no walls with our states, as much as, I think it's great that we coordinated because it makes sense. But the bottom line is, that's true with towns. That's true with when Hartford's numbers started to go up. I mean, it was just a matter of time before West Hartford's numbers went up. So, we've got to really, really be vigilant about how we protect ourselves and not put ourselves at risk. And I know, Thanksgiving is my favorite holiday. Being Jewish, it's really, it really is. And everybody really rallies to come in. We usually have 40 people. And it's breaking my heart, but I know I'm not going to put people at risk. We're not going to put people at risk, and we're going to do it from a distance this year. And hopefully next year's will be extra, extra special. So, and I just hope people really listen to that. And college students coming home is a real, it is a bit of it's really challenging actually for families. And, and the colleges need to be careful too. Having them leave, getting them tested, really helpful to do that,
Is West Hartford going to put out any messaging about, right before Thanksgiving, not only about the holiday, but also about maybe some precautions to take with your college students or some advice for?
Yeah, I think probably midweek next week will make sense to do that. That's my thought. So, I do get input from my other, my colleagues, fire department, police department, health director first. I should have said her first and foremost, and town manager to coordinate a message. So I'm hoping that we can put something together for next week. But yeah, I think that makes a lot of sense.
Well, I have no more questions. I think this was a great show. The engagement, Sherry, I don't know if you see it on your end, but Ronnie and I see it, on the production end. And just the comments haven't stopped. So it's really quite incredible.
There's a lot of chatter going on.
I would say
it's all positive. No snarkies, today, which is nice.
Thank you, because we're working really hard.
I think people recognize that, and that's what Governor Lamont. I think he's been head and shoulders not the best governor in the region. I think he's been the best governor in the country in terms of his handling of COVID. And I don't want to get into that with him online because it's not appropriate. But he's just been. I'm supposed to be an objective news reporter here, but if you look at this objectively, he's done a fantastic job. They're going to name a bridge after him or something, I
think he's really listened, and that's what I don't know if other leaders sometimes do that. And I think it's so important to listen to the experts. And then also he did listen. He tried to strike a balance between business and, our safety first, but the economic, keeping our economic world going a little bit, and so it's been challenging. So I think people respect when he has to scale back a little bit, because the minute he feels we can, we're gonna be back up and running. So, but it is a little scary because we've never been in this place before, heading into, as you said, complete community spread. This is not an isolated, senior housing kind of limited to one place or another place. This is community spread. This is what it looks like. You can't isolate you can't, so you have to be careful everywhere you go.
Well,
Do you have any feel for any changes that we might need to see in West Hartford going into the winter to try to combat this a little bit more? Restrictions in our businesses or gyms or?
Yeah, and not uniquely, I will say. I think we're going to remain vigilant, and probably even more so with making sure that businesses follow the guidelines and the restrictions, and that is for everybody's benefit. It's for the business's benefit as well as the patrons. So I just hope people know that we're not attacking anybody when the health department is actually following what they're being told to follow. So follow the restrictions, and hopefully things will be better. And be honest, if you have somebody that had a COVID, take those precautions now, because it's going to get worse if you don't do it. Take the action now. Be open. Make sure that you share it, because again, if you're the source of spreading, it's not going to be good for your business. So
right there. Well, no, this way.
No, there you go. Yeah,
exactly.
Sherry is not aware of the whole story.
I'm not aware of the whole story.
So
But
no. I woke up on, I guess, Monday, and I got hit hard. And today, this afternoon, I'm feeling better. But even this morning, I was almost.
'cause I think I checked you. I think I sent you a text on Saturday or Sunday to check.
Yeah, because Sydney, and thankfully, I am a believer in the various strain theory, and knock on wood, that we got a mild strain of this thing. Sydney is.
I know this is like somebody told me today that blood types matter. Do you know? I don't think
I know. I don't have a clue. I know blood type O is a good thing. I don't know what blood type I am. So, but
Really?
I agree. Yeah. Blood type.
Positive is pretty resistant. And this is, again, I don't think that's from the scientists. I actually typed it in on my Bloomberg, conference this afternoon, but I didn't get an answer.
Well,
Actually, I did read something that was very long and technical about blood types, and it has to do with, I'm not a scientist, but the viscosity of your blood and different types of symptoms tend to impact people with different blood types more. So it's not that necessarily one blood type will keep you healthier, but you would tend to have slightly different symptoms depending on your blood type.
Right.
So I'll make 2 points. One, to Sherry's comment. Once I realized, it had infected our house, it's really easy to habitually do things that are really bad, that are normally fine, but it's like, oh, I'll run an errand. I'll run to Stop and Shop. And it's like, Jessica, I would have to reel her and she would reel me, and like, you forget. So that's number one, to your point, Sherry. And number two, I'll make 3 points. Number two, it's really awful. It doesn't make you sound like you have a cold, but it impacts every part of your body. It's really awful. I mean, you don't want the disease. Take the vaccine. That's point number 3. When the vaccine becomes available, trust in the science. Take the vaccine.
I actually tried to get on a trial.
I did too. And Sherry, you know why we didn't get called? You're right. All right. So a couple points. This is interesting on the vaccine. The reason why we didn't get called is because Governor Lamont did such a good job. When they were really going hard on the trials, we were doing 75, 80 cases statewide a day. So they went to states like Florida and Texas and Arizona that were in the ditch, which makes sense because they had to get the data. They were desperate for the data. So that's number one. And then what was the other point?
You said, so take it seriously. Don't go out, really change the habits and then
it's hard.
This is serious. My brother-in-law and sister both had COVID. My sister is 2 months later, still has headaches every day.
Yeah, some people have.
You never know.
And if I wake up feeling like this tomorrow, I'm going to be, thank God, because I had what the CDC would define as very mild symptoms. Sherry, it was awful. I mean, Ronnie was getting updates from me every day. You weren't, but you do not want this disease even in a mild form.
Right. No.
Horrible. And the brain fog, it's real. Like I couldn't think yesterday.
Mm.
So
did somebody bring you a thermometer?
So no.
No, okay, we're gonna have to get you
I'm
one.
on my thread, but it's like almost dead. But I felt so much better today. I haven't had to take my temperature.
Wow. And what was the third thing you said? You had the third point. Brain fog.
Third point, vaccine. Trust in the
Oh,
science.
yes,
Trust
absolutely.
in the science. And don't be a moron. I'm sorry, but don't be an idiot. Vaccines are not bad. There was one bad vaccine in history, the swine flu or pig flu, whatever it was, 1976. That's it. Every other freaking
These are
was good.
the largest samples, the largest testing that they're doing, the largest clinical trials that they have done in any situation. So, and they have stopped trials when they needed to. So, and they determined that they could proceed because that wasn't related. So
These companies are good citizens, and they care about the community. They really care about being a good member of the community. And
the best news is that they were anticipating 50%, effectiveness. Now there's, the initial are talking 90%, which is really amazing, actually. So that's
there's still some unanswered questions, like is it the type of thing like a flu shot you have to do every year or two? Or, there's still some unanswered questions, but 90+%, and people can recatch this.
Yeah. So at today's call, I actually, somebody asked about first responders, police officers, firefighters have had a lot of, many of them around the country, and we actually have some quite a bit of our staff now, also in quarantine, not from individual events in their homes. Something happened, whatever, and they're quarantining. So, but if you are a first responder and have had it and have antibodies, should you get the vaccine? Because they're going to be the first ones to get the vaccine, and they're saying yes, because we don't know how effective those antibodies or how long they're going to be effective, and yes, to get those vaccines.
I think going forward, that's going to be a big part of the task for governors and for mayors around the country is messaging. We've got to get people to trust the process.
Distribution, right? And making sure that everybody that can get the vaccine will get the vaccine.
Yeah.
I don't know if the community knows that West Hartford, with the flu shot, drive-through flu shot, was kind of testing the methods of distribution for the COVID vaccine eventually.
Absolutely.
And that went pretty well, right?
It went well. Yeah. There's another one coming up Thursday. I'm not sure. Is it next week? Next Tuesday, I think, 4 to 6. And no appointments needed. And, oh no, that's testing. I'm sorry, I'm getting confused. But yeah, we have another flu shot clinic coming.
They are. I will say, I didn't want to go there with the governor today because I tried to not repeat everything they did on the conference call today because I just felt like if you don't know this, just go watch the conference call earlier today. So I tried to either break new ground on the same topic or talk about new topics with the governor. But one thing that came up on the call today was there's a bottleneck at the testing level. It's not at the results, whatever you call that. It's at the where I need to go get a test. I can say
it's not in the lab. It's
not the lab. Thank you, Ronnie.
Yeah.
It's
the collection point.
It's at the collection point. And I can tell you firsthand experience.
Did you say anything about that? Because I just received a very long text from somebody about that as well.
He said it on the call today, not on this newscast, but on.
I called during the call, so I didn't hear all of it.
His guy, and I'm sorry, Ronnie, I don't know his people. You do, but
so Josh Gabel said that there's a lot of work going on to increase the number of testing centers, and it's not a supply; it's more of a staffing. And there are 30 more coming online, and that's being increased. And he's optimistic that we won't see that bottleneck much longer. But we're up to 200,000 tests a week, which is
pretty impressive.
Yeah, those are the numbers that they were talking about early in the spring as a goal, and it seemed insurmountable when we were at, I don't know, back then, like 10,000 a week or some.
I think you're right. I think that's where we were. Yeah, no, and the convention center, being a spot now that Hartford Healthcare is going to be having their drive-through through there. But
we have 2 in West Hartford, 2 more coming up, right?
Yep.
2, yeah.
Yeah, Sarah Rice just posted that there's
Tuesdays. Those are the testing are on Tuesdays then every Tuesday through November.
At the Elmwood Community Center.
No, and no appointment needed.
Mayor Sherry Cantor, proof that leadership matters. So thank you very, very much for coming on. And
Thank you.
I think Ned was really happy to see you.
Yeah, I'm sure. But, you know, I mean, we are all in this together.
Yeah.
And nobody, when they really had an interest in doing this position, you know, whether it's governor or mayor, thought that we would, you know, that it's kind of this.
Yeah, there's no playbook for it, is there?
For it. John, I hope take care of yourself, and I hope you get better every day. I really
I hope I do too. I hope if I keep improving the way I've improved today, I got off scot easy on this one.
Okay.
Really. So, yeah. So
anyway, thank you both, and thank the public for listening, and for helping each other and somebody like John is stuck at home and they need something, you know, offer to get it for them.
And I will say, both of the people on this broadcast with me right now both offered to bring me something. Mary said she wouldn't cook for me, but both said they'll bring me anything if I need it. But fortunately, I think we
bring you takeout.
Well, yeah, we did do takeout. We got I forget what we got something at some point, and then Jessica figured out how to order online from Amazon Prime at Whole Foods. So we got a big Whole Foods delivery about an hour ago. So that was very good. So people should be able to, you know about and avail themselves. You know, Peapod for Stop and Shop. And
if you need help and you don't have that ability to order on Amazon or whatever, we do that. You know, our health department, our fire department, our social services department, we are there to help. So please call me personally. You can call me, or the town, call social services, and we will get you the support you need if you do need it. Please.
Yeah, it's no reason to go out and
it's so
risk
easy
exposing.
Habitually. That's what I kept, to fall into. It's like, oh wait, we're quarantined for 14 days. Gotta remember that. This stuff matters. People catch. It's really easily transmitted.
Yeah. So I downloaded the app today too.
I did.
Activated it.
Yeah.
I had to wait until I could take a screenshot of each phase so I can turn that into a story too. Yeah. And I did that as I activated it.
That's very cool. Wonderful.
All right.
I ever said so contagious, just again.
I speak from experience. It is highly, highly contagious. It's vicious. So Mayor Cantor, thank you. We always love having you on, and I think this was a great show. Ronnie, great show. Thank you very much. Any parting comments or
I'm going to go get a lobster roll.
That's right. You are. You're heading over. I can't. I'm not allowed.
You're not allowed.
My ankle monitor will alert, so I can't go as much as I'd love to get a lobster roll right now. So anyway, thank you.
Leave one on your porch?
I'm sorry?
Should I leave one on your porch?
No, that's okay. No, I think Jess has got something going on upstairs. So anyway, but all right. For Ronnie Newton, managing editor of